remember that she doesn't know anything. Carter Peckham.
Nice.
So I'm going to wing it a little bit today. Rebecca's going to be my assistant. I wanted to give you guys a little bit of history about me. Kind of hard to believe I've been practicing for 15 years. It makes me sound old. I've been practicing in outpatient orthopedics for about 15 years. I've been out on my own for the last 6. The main reason for that is I kind of feel like my profession is doing itself a disservice. Like a lot of medical practices these days, it's really kind of all numbers driven. I really felt as a director of a large corporation or large clinic or corporation that I was kind of doing the hamster in the wheel thing. I didn't feel like I was really serving my patients well, and I wasn't giving them the care that they needed and the care that I could provide them. So that's really kind of why I went out on my own, and I'm back to loving my profession, and I'm really passionate about it. So that's what's unique about me. You come into my office, I'm the only one you're going to deal with from the front end to the back end. So that makes it a little unique in the physical therapy world. So, Rebecca. I'm going to use Rebecca as a kind of a guinea pig today, just so you guys can kind of see a little bit about what I do. A lot of people don't really know or understand what physical therapists do or how we treat. So I know Rebecca was in an accident, like 2 weeks ago?
On the 8th, yeah.
Okay. So she's had a little bit of neck pain, started on the right, now it's on the left. So we work together, so I kind of know these things already. So I'm going to do a really quick assessment so you can kind of see the way that I look at someone. If you wouldn't mind standing in front of me. So the first thing I always do is look at someone from the bottom up, and I want to see if their body has been affected by a trauma in some way or another. Just looking at her, and I'm going to do this really quickly, I can see her left shoulder is quite elevated, which is affecting her neck a little bit. Can you come back here? And turn with your back to the group. So can you guys all see that? That left side's a little bit up.
Yeah.
So she's having a lot of spasm right in here in the trapezius muscle, and that's a normal response to a whiplash type injury. Those muscles will kick on to protect the neck, but over time they don't necessarily learn to kick off, and then there can become dysfunction. So I'm thinking in the long term, one of the things I want to look at is how she uses her shoulder. I know she's a massage therapist. She uses these muscles in the scapula quite a bit in this position. So if she's going to start overusing this muscle, this is going to become a problem down the road for her, and she potentially is going to have chronic neck pain or even rotator cuff problems because of that. So I'm going to watch you back and face them. Raise both arms up overhead and back down. Okay. Go forward. I'm sorry, arms forward. Good, all the way up and all the way down. Okay, so turn to the back of the group. So I want you guys to be able to see go forward with your arms. She's hiking her shoulders quite a bit. Go ahead and go all the way up. She's hiking her shoulders quite a bit to raise her arms and then come back down. And if you watch closely, go ahead and repeat that a few times. She flutters on the way back down. You can usually see that if you've got a trained eye pretty able to go out to the side again and then back down. So especially when you see that flutter, that's an indication of a weakness, and that's something that down the road, maybe not right now because she's in pain, I would want to test that and see what muscles are weak there so that we can start taking the work away from this muscle so that she doesn't end up with chronic problems down the road. Let's have you sit. So bring your chin down towards your chest. She doesn't have a lot of range of motion there. Normally, neck flexion, you can have 80 to 90 degrees of flexion. What do you feel when you do that?
Just tight in the back.
Both sides?
No, straight in the middle.
Straight in the middle, okay. And then tip your head back. Anything in the back or the front with that?
Right there.
Okay, so go ahead and come out of it. The nice thing that I didn't see her do with a whiplash injury, what I'll always look for is somebody that tips their head back and opens their mouth to do it. That usually indicates the muscles in the front are the problem, and then there's a way I test to look for that. I didn't see it, but she did tell me that it was tight, so I already know that I'll probably address those muscles. Knowing what I know out of 15 years of practice, the muscles in the front, when they're not addressed, eventually down the road, and Carl can probably attest to this, usually about 6 to 9 months down the road, if the muscles in the front of the neck aren't addressed, you're going to start getting TMJ disorder because of the muscle in the front, the platysma and the suprainfrahyoid muscles. So that may be something I want to look at and have her stretch now so that she doesn't become problematic later. How about turning to the left? left side is still standing out. How about looking straight ahead and side to the right?
It's
Not very good.
Thank you. Not well.
And then 7 to the left.
That one's not going anywhere.
So you're kind of locked up there. Okay, well, you have your light on the table.
When you said if you could put a body on there, I thought you were bringing like a resuscitation type thing.
So next phase, so a lot of what I do is I just look at people. I see how they move. That tells me a lot about what's going on with them. Where's my time? It's a minute left.
That'd be a good question. I forgot.
You got 2 minutes.
Mark's got a timer. Mark, how much time? 2 minutes.
So then I'm just going to palpate and see soft tissue wise.
No, it's not fun.
Scalenes on the left side, and then just to assess her joint mobility. So I'm going to go ahead and treat soft tissue. And so when I work on soft tissue, it's not as nice as when Rebecca works on soft tissue. So I just kind of get in there and just, I'm not very nice about it. So I'm just going to free that up a little bit. She'll probably make some faces. And then I'm going to work on, I may try to stretch her out a little bit and see if that frees up the joint. And if it doesn't, then I'll do a joint mobilization. So what I can't do in this state is a grade 5 manipulation. That's what Paul can do. In this state, I'm allowed to do a grade 1 through 4 mobilization. So I won't be doing any thrusting or popping or cracking on purpose.
That's a great spot. Wow.
Research her by Saturday morning, that's all I have. That's my wife's appointment.
So now I'm just getting in and doing a little joint mobility work. And I'm going to go ahead and stretch her out because I know her scalenes are a bit of an issue.
Her what? Scallions?
Her scallions. Her scalenes.
It's different.
So the scalenes are on the front of the neck. I can see it already when I put a stretch on her ribs. The scalenes are kind of starting to stand out a little bit. So I'm just going to stretch them a little bit until I feel them release. There you go. One more. Whack one.
Oh, great.
I've never had anybody neck pop off yet.
That's good because she has appointments.
Yeah. I know, I'm number 1, right?
Really awkward when you
Sorry. I think your insurance.
Does that spot removal take care of blood? I just thank you.
It does, but I'm not about.
do you have supplements?
It's like doll surgery. That reminds me, Mark, I gotta file a claim.
Nice.
I'm gonna go ahead and do the other side. She's tight on both.
How come you're wincing
I
back
don't
here?
like this.
I call it payback for what she does to me.
All right.
Vengeance shall be mine.
So you guys could just go back to your office and do this all day.
Yeah.
We could if we didn't want to make money.
We really hardly ever see each other, so this meeting is the only time we actually get to talk.
I did this to help me because we.
And Carter, you do accept PIPs, so when people are injured in car accidents and they would need this kind of care, you would be able to help them, correct?
Correct.
Very often, can you just go to the PT if you want to go to the PT, or do you?
With most insurances you can. With a personal injury protection you can. It depends, like private insurance, it depends on your plan. But that's something that I check on for my patients beforehand, so I'll let them know if they need it.
So your time is up.
Yeah.
Whether Rebecca's done or not, that time is up.
All right.